ಸ್ವಲ್ಪ ಸ್ಲೈಡ್ಸ್ ನಂದಿಲ್ಲ
ಆಯ್ತು ಸರ್. ಹಾಂ ಸರ್. ಹಾಂ ಯೂಟ್ಯೂಬ್ ಬಂದ ತೋರಿ ಇದು.
ಸರ್ ಡೈರೆಕ್ಟರ್ NIS ಆನ್ ಇದೆ. ಹಲೋ ಮೇಡಮ್.
Yes, sir. I have joined, sir.
Thank you, madam. Thank you very much.
Yes, sir. I am in the line.
Okay. Thank you, madam.
Okay,
Thank
sir.
you very much. Yeah, we'll in another 5 minutes we'll begin, madam.
Good afternoon, everybody. Respected Principal Dr. Suhas Kumar Shetty sir, Director, National Institute of Siddha, Chennai, Dr. R. Meena Kumari Madam, fellow faculty members of KLA Ayurved, and PG scholars and UG scholars, I wholeheartedly welcome you for the event of this 6th Siddha Day celebration. We are celebrating it for the first time as an Ayurveda institution in the stream of Ayush. I am very happy and delighted to say that we are also a part of Siddha system of a medicine, and under the guidance of NCISM New Delhi and under the guidance of our beloved principal, we have framed few of the programs for the first time uh, to celebrate this Siddha Day, so that to motivate our scholars, our community, our staff members regarding the allied system of medicine. Let us grow together with this system, with this health system, and let us serve the society all together. So in this connection, we have framed a few programs, namely introduction of Siddha system to the UG and PG students. We have executed it. Awareness among the public regarding Siddha system of medicine in many places. We have given the awareness to the public. We have displayed the banner in and around the campus. And importantly, we have prepared the Siddha recipes as NCISM. From the NCISM office, we got some very simple preparations, and we have prepared, and even we have adopted it as a therapeutic diet for our in-house patients. And introduction of Siddha medicine to the general public. This also we have done with the basic information what we got from NCISM, we have delivered to the common people. Now, I wholeheartedly welcome our director, National System of National Institute of Siddha, Chennai, and I wholeheartedly thank you, madam, for accepting the invitation and coming over this platform to deliver a introductory guest lecture for our students. Now, I request our beloved principal, Dr. Suhas Kumar Shetty, sir, to say the keynote for this very event. Sir, please.
Very good afternoon to all of you. On behalf of KLE Academy of Higher Education Research.
Please mute yourself, the audience, I request.
On behalf of KLE Academy of Higher Education Research, Belagavi, deemed to be university, and KLE Shri B.M. Kankanwadi Ayurveda Mahavidyalaya, I take this privilege to welcome you all for this a very unique invited guest lecture on the basic understanding and uniqueness of Siddha. And I think we're really honored and very fortunate enough to have a very eminent speaker for this, the director of National Institute of Siddha, Chennai, Dr. Meena Kumari, madam. On behalf of the institution and the entire university, we would like to welcome you, and we really thank you for sparing valuable time and probably for gracing the occasion. We're very happy to be associated with you for since few months, and very happy to meet you in person also when you are visited to the ICMR, National Institute of Traditional Medicines, and also had an MOU exchange between these two premier institutions. And I was very happy to be a part of this MOU exchange program also, which we had during that particular period. And once again, I'd like to welcome you for this and thank your entire organization for being associated with our university as well as with the ICMR unit. As you all know that probably we are moving ahead where we are trying to look at the best possible healthcare system to the integrative medicine. So generally the perception is that when you're talking about integration, we are probably trying to talk about the integration in terms of one of the system of Ayush with the contemporary science. And that's how generally the whole idea of the integration is with us. Though that is one of the very potential areas, but I think other areas where we should really explore is how there could be integration among the different systems of Ayush. And that is where probably such awareness program, sensitization program, and trying to understand the similarities and the differences of these systems will play a very major role to help understand each other, and also probably try to understand where we could probably try to integrate in the best interest of the common people or common public. And if you look at the history as well as the lineage of the Siddha system of medicine, as well as if you look at the basic concepts that are present in the Siddha, See, basically, Siddha is the one who is accomplished with the good knowledge, or one who is Jnanavan is said to be the Siddha. So the people who is trying to take care of these people should have the accomplishment of knowledge and should be able to inculcate and transform this knowledge for the patient care. And that is where the Siddha system of medicine, which is very much popular in the state of Tamil Nadu, at the same time equally getting popularized in other state as well as in the other parts of the world, is really appreciable. And if you look, as I was telling, if you look, just look at the basics, no, there are a lot of similarities that we can see in the basic concepts and how they understand the human body, how they understand the different therapies. Even if you look at the basic therapies also, like they have the divine therapy, the medical therapy, the surgical therapies, are the three basic therapies with which they work. And there are a lot of metals and minerals which has been used in the system of Siddha, which also, like, there's a separate branch also in Ayurveda which talks about in the medical pharmaceutics in the form of Rasashastra and Vaishnaja Kalpanas, where also we have a lot of such metallic preparations which are used for the medicinal purpose. So I'm sure such a sensitization program will not only create interest among the faculties and students of the Ayurveda and other traditional system, but also pay away for the possible integration in case of the healthcare as well as research in the Ayush system. So I really appreciate the efforts that is taken by the Department of Sasruta and the interest taken by Dr. Ashok Patil and his team, and also appreciate Dr. Kadambari, the coordinator for the guest lecture series, for nicely arranging and organizing this particular event. And I'm sure this particular valuable informative talk by the eminent speaker, Dr. Meena Kumari Madam, will be appreciable for all of us. I also welcome all the different delegates who have joined from different institutions and also from different parts of India for this program. So I'm sure this will really ignite a new understanding of the system of medicine. So thank you once again, madam, and I welcome you all for today's talk.
Thank you, sir. I wholeheartedly thank you for the apt keynote what you delivered in this very session, sir. I take this opportunity as the madam first time she is addressing to our KLE Ayurved. Let me take this opportunity to introduce madam to all the audience. Dr. R. Meena Kumari, Director, National Institute of Siddha, is a postgraduate in Siddha medicine with the specialization in Gunapadam, Material Medica. She has 30 years of experience as a clinician, teacher, administrator. She guided numerous students in their dissertation works and doctoral research works. And namely, Madam has occupied many chairs, responsibilities, out of which Madam is a chairman, Board of Studies of Siddha, the TN Dr. MGR Medical University. Madam is a member of Board of Governors, NCISM, member advisory committee NCISM for the survey of Ayush female graduates, member of Senate, the TN Dr. MGR Medical University, State Planning Commission member, Government of Tamil Nadu, Editor-in-Chief, Journal of Siddha, and many more. Madam is also noteworthy to mention about Madam has contributed by publishing many journals, many articles in the medical research, and even especially Madam has published a few articles efficiently against COVID-19 infection. Under her dynamic leadership, synergy has been established with many research organizations for establishing the efficiency of Siddha medicine treatment. Nearly 25 MOUs have been signed with the various public and private organizations for knowledge transfer and career development of faculty members and students of National Institute of Siddha. Madam, I once again wholeheartedly thank you, and we wholeheartedly appreciate for your enormous achievements. Now I request Dr. R. Meena Kumari Madam to deliver the guest lecture on introduction of Siddha system to the Ayush fraternity and its importance. Please. Madam.
Hello, madam. Meena Kumari, madam.
Yes, sir.
You start, madam.
So once again, I would like to welcome Meena Kumari, madam. There were some technical glitches. Now may I request the Director of National Institute of Siddha, Dr. Meena Kumari, madam, to kindly guide us and enlighten us with the introduction to Siddha and its uniqueness. Over to you, madam.
Good afternoon, everyone.
Yeah, we are able to hear, madam. Please continue, madam.
Yes, sir. So I'm very happy to join with you. Uh, um, I have some opportunity during our previous visit to Belgaum to meet clearly Ayurveda principal sir, and he described everything about Siddha, and they expressed their hope, trust towards the Siddha system. Um, Sir, I am trying to present my PPT. Kindly
Okay, ma'am. Okay, ma'am. No problem. By the time you can just give some basic introduction, and once the PPT is ready, we can continue, ma'am. It's okay if you can present without PPT also, ma'am.
இது ரெடி மேடம்
PPT போடுங்க. And we are aware. இப்படி இருக்கும். இப்படி பேசுறது. கேட்கறவங்களுக்கு பிரச்சனை.
சரி பண்ணி
இதுக்கு வந்துருங்க. அது இப்படி க்ளோஸ் வீடியோ போடுங்க.
PPT.
Okay. Sir, whether
We did-
audible?
Yeah, audible, and the slides are also visible, madam.
Okay. The sound குறைச்சிருங்க. Sir, actually, we are having some problem in our, and it is echoing a lot.
Ma'am, I think you should not have two systems. Only thing is, if we have two systems in
Only
the
one
same hall,
system we are having.
like if this mobile land system is
Yeah.
there, then it will echo. Otherwise, we are able to hear you very clearly, madam. You can please go
Okay,
ahead.
no problem, sir. Let me sound குறைச்சிருங்க. Sound குறைச்சிருங்க.
Okay. Actually, ரெண்டு இதுல join ஆயிருக்கு.
If you can make the slideshow mode.
Okay, sir. Now
Fine.
it's okay.
இப்போ echo problem stop ஆயிருக்கு.
So now it's okay, I think. Isn't it, sir?
It is okay, madam. It is okay. Now we are
Okay.
hearing clearly. You can
Okay,
go
okay.
ahead. Please proceed.
So, sir, actually, we are very happy that people from Ayurveda side, they are having so much of trust and coordination with Siddha system, and it is our pleasure to know about you to celebrate Siddha Day in an Ayurvedic institute. Like a very prestigious and very unique institute like KLE. During our visit to Belgaum, we came to know about KLE and their support to NITM. Dr. Subarna Rai, for the past 20 years, you are in touch with the NITM, and you are supporting them also, and you are promoting our traditional system through various camps and research activities in and around Belgaum. We are very fortunate and we are very lucky to have you, to have a link with you through NITM, and truly, sir, it's our immense pleasure to have you to unite our system to your institute, not only from NCISM or UGC. This initiation is came from your heart, bottom of your heart, because such a generosity mind can initiate this type of celebration in our institutes. We are also celebrating Ayurveda Day in our institute, and we integrate some Ayurvedic procedures in our patients OPD itself. And I want to explore some amount of Siddha concepts to the Ayurveda fraternity in KLE. And I am very much thankful to the organizers of this seminar, webinar. I personally thankful to the principal of the KLE Ayurveda College and the organizer of this webinar, sir. Actually, Siddha system is one of the ancient system, and it is very ancient as Tamil. You may know about Siddha system is otherwise called as Tamil Maruthuvam. It is came from the ancient Tamil literatures, which are age old, back to the 5,000, 10,000 years back. Our Tamil ancient literatures contains so much of medical quotations and medical manuscripts. Medical textual references are written in Tamil Sangha period, sir. So the word Siddha itself, it means the attainment of perfection. One who prefer the Siddha, which is derived from Siddhi. It is Sittam. It is otherwise known as our conscious, inner conscious mind, like that. So one who consciously take one ambition in their mind, then they are trying to attain the perfection in the lifespan. which is meant by Siddhi or Siddha. So Siddhas are such people to such people, they can they are capable of doing im, uh, impossible things into possible, and they are capable to make everyone capable, for making one through health, and came through the capable of treating diseases and make everyone healthy and make them to capable to do anything they aspire in their life. This is what we call as Siddha, Siddhas, and Siddhi. So, in this meaning, we can know about our the strength of Siddha. So, one sage who is called as Tirumular, one of the ancient, one among the 18 Siddhar, he described medicine as a whole. What is medicine in this prose? He defined uh, the medicine one which is capable of preventing diseases, medicine one which is capable of um, treating the disease, one which is capable of prevention of disease, one which is capable of death also, death also. These four category, a drug should contain these four category, then only the drug can be that product can be called as medicine. Like that, the மறுப்பது உடல் நோய் மருந்தெனல் ஆகும். மறுப்பது உடல் நோய் means physical disease. உள்ள நோய் psychological disease also, drugs which are capable of treating psychological diseases. So prevention, இனி நோய் வாராதிருக்க is prevention. மறுப்பது சாவை means சாவு means death. So the death can be prevented through a drugs, Siddha drugs. That like that, our Tirumular, sage Tirumular described a drug. Even WHO definition for drugs is also very much comparable with these quotations, sir. You can compare with WHO definition for medicine. Here you can see the மறுப்பது உடல் நோய் மருந்தெனல் ஆகும், மறுப்பது உள நோய் மருந்தென சாலும், மறுப்பது இனி நோய் வாராதிருக்க, மறுப்பது சாவை மருந்தெனலாமே, which is called as drug or medicine. So in our Siddha system, we are based on microcosm and macrocosm. That is, our body is called microcosm, and our the universe is called macrocosm. So we are having some connectivity through the universe and cosmos, through the Panchabuddha theory. So our the Panchabhuta, earth, water, fire, these are all from Ayurveda also. Ayurveda also denoting these Panchabhuta theory. So these physical and functional constituents of human beings is well connected with the cosmos by the 5 elements. So Siddha system otherwise based on 7 basic tissues like lymph, blood, muscle, adipose tissue, bone marrow, and sperm and ovum. These are all primordial elements, that is Panchabhutang, based on the combination of the certain percentage of Panchabhutas. So lymph is purely water, blood is fire plus water, like that. So these 7 tissues is created through the combination of 5 Panchabhutas. And our system is based on 3 vital humors, that is Vadam, Pittam, and Kabam. These are all as like in Ayurveda. So as in Ayurveda, we are slightly differ from their concept, because in Ayurveda, Vadam is a destructive force. I think they are telling like that. But in our Siddha, Vadam is the creative force, Alal is the sustaining force, and Ayam is the destructive force. So based on this 3 humors, we are diagnosing the patients and preferring the drug for the particular patients. And we have some diagnostic principles through the interrogation, inspection, and coordination. So these are all eight எண்வகை தேர்வுகள் அஷ்டாங்க பரீட்சா in Ayurveda also. These are all Ayurveda and Siddha are having the same patterns. And in Siddha, we feel three humus in the pulse itself, because the index finger denotes the Vadam, middle finger denotes the Pittam, and the ring finger denotes the Kabam. So Vadam, which will run for one மாத்திரை அளவு, the duration which is we call as மாத்திரை, that will palpable for one மாத்திரை அளவு, and அழல் பித்தம் is palpable for half மாத்திரை அளவு. If it deviates from this duration, which can cause diseases. So this is the sastric prose in our ancient text, how to perceive the pulse, and how to hold our hands, how to pressure, how much pressure should be there in the fingers, and how long we can palpate the pulse, which are all described in this prose. And again, we have some எண்வகை தேர்வுகள், that is Ashtanga Pariksha, that is urine test, நீர்க்குறி, which we can, through interrogation, we examine the urine with its color, smell, quantity, frequency, specific gravity, and frothiness. And Neikuri, which is very unique in Siddha system, and we collect the urine in the early morning, first urine, during before 6 o'clock, and in a earthen pot, and we drop a gingerly oil, drop 2 or 3 drops over the urine sample. Suddenly the oil will spread across the urine, in the upper side of the urine, and it will show some figures in the urine pattern. Sometimes the oil may look like a snake. Sometimes the oil may look like a sieve pattern, with holes in and around. Sometimes the oil may look like some monstrous appearance like that. If we according to the figures found in the urine pattern, we can diagnose the disease is due to Vadam derangement, or Pittam derangement, or Kabam derangement. If it is monstrous appearance, the disease may be very, very fatal, and sometimes dreadful diseases like cancer, AIDS, like that. So the urine pattern, the Neikuri, whether I don't know, is the see here we can some pearl like muttatu nirkin, that is like pearl like, it is Vadam. So sometimes the urine may look like a snake. So it will denote Pittam derangement. Accordingly, the Kabam, it may like sieve like pattern, holes, multiple holes in the superficial area of the urine. So it will call as Kabam derangement. According to the color, the dark color denotes Vadam, red color denotes Pittam, like that, and pus or gray like that will denote IM derangement. Accordingly, we are diagnosing our diseases, sir. So we can compare these Neikuri and Neerkuri to the modern diagnostic procedures. So this is this Neerkuri and Neikuri, that is urine examination, is very well described in Therayar Siddhar, in his Therayar Neer Nirakuri ancient texts. So accordingly, the colors of the urine denotes some diseases over the diseases due to, if it is yellow color over it denotes very very heat in the body, and if it is green color, it is due to poisonous some poisonous bites or poisonous intake, poisons due consumption of poison, like that. So like that, the bone tuberculosis will look like a pale white, and the serious IM disease will look like clear white urine. Like that, we have prepared one chart. Accordingly, we are testing the urine patterns in our OPD and IPD, sir. And in our Therayar, like Therayar ancient Siddhar, he denotes Pini Anuga Vidhi, which means Pini means diseases, Anuga Vidhi means prevention, prevention for protection from diseases. So he recommended 25 20 to 25 quotes. He denotes to follow some lifestyle modification in our day-to-day life pattern. So he, in his concept, he whether it is available, let me check it. Yeah, here he denoted in his prose, every day we have to take drinking water after boiling. So every day we have to take food twice a day. 2 times a day is very good for our health. We are taking so much of foods, excess foods, and unwanted, untimely foods, which causes diseases. So his quote, how he is denoting, see, we have to drink water after boiling, we have to take food for only twice in the day, we have to dilute the buttermilk, then only we can take we have to use the buttermilk, and we have to melt the ghee, and we have to use it. Without melting, we should not use ghee. But we have to every time we should take ghee in our daily life food habits. And we have to, often we have to take cow's milk, it is very good for health. And we have to this is very well mentioned in Ayurveda also, because every 6 months we have to go for emesis. We have then only our vadam will be in a balanced way. And every 4 months we have to go for purgation, that is it should be habitual. Every 4 months we have to go once for purgation, then only our vadam will be in the same balanced manner. So like that, we have to use nasal drops for 45 days, and once in 45 days, and we have to take oil bath once in every 4 days, and we have to use eyeliner, medicated kajal once in every 3 days. And we have to sleep always in the left lateral position, and we have to um, worship our ancestor, our seniors, guru, like the teachers, god, parents, like that. So like that, he is telling so much of conditions, then only we can he challenged the yama. He will not come to us at any time. If we follow the all the conditions, Yama will afraid to come near for us, like that he will write. So how challengingly he denotes the healthy habits of day-to-day life practices in his prose. It is very surprising, and very we advise people to follow all these healthy practices in their day-to-day life. Yeah, sir. And yeah, in his prose, we should not use old foods to eat, and we have to take without we should not take meals without hungry, like that. He is denoting so much of quotations in his prose. And so yeah, he advised walking also. After eating a meal, we have to go for walking. So these are all scientifically proven factors. Some of the factors are supported by scientific research papers made by our students, PG scholars, and faculties. These these Theரையர் பிணி அணுகா விதி முறைகள் are undergone some scientific paper presentation, paper publication in some journals. So in our system, we are recommending unave marundu marunde unavu, which means our diet is our medicine. So we have to take diet as medicine, and we have to measure, and we have to properly take with the guidelines which is meant guided by say siddhas, so many siddhas. We have to take food as medicine, and we should not take unnecessary meal, excess meal, or less meal, like that. So seasonal meals, like that, and diet for elderly people, child, and female, pregnancy, everything. The siddhas in Siddha text, they have segregated diet in so many ways. So we have to educate the people according to the Siddha's guidelines, that in our lifestyle practices. If we practice the methodology taught by Siddhas, we may prevent all the new diseases, or even NCDs, like that. So major portion Siddha, all Siddhas, they are very much keen in how to take the food, how to prepare the food, how to take, and how much to take, which is apt for children, which is apt for elders, which is apt for working people, like that. So they are very very keenly observing so much of guidelines, and they advised people to take follow all the guidelines to prevent disease, and or during the disease itself, they meant they mean some diet control in the name of pathiyam. So patya abatya vidigal is also there. So we have to follow that pathiyam and abatyam along with the drug regimen. We can easily get cured from our ailments. So the food should be in 6 tastes. So every food should contain these 6 tastes. But nowadays we never use bitter or astringent or pungent taste in our diet. We are go for sweet and salty, or otherwise palatable or plain food products. We have to adapt 6 tastes in our food, in our day-to-day food habits, so that our 7 tissues will remain in a balanced and good physiological state. So we have to prefer our food like that. So time to time and season to season, it is described very much elaborately, and we will see some of the examples in due course. So another one a great topic is Kaya Kalpa. This I think it is also described in Ayurveda also. In Siddha, this is very much described to maintain a good health, and to not only good health, one who wish to attain a super perfection in their lifespan. They have to live long. They have to live long for even apart even of beyond 100 years. So that for that, as earlier described by Sage Tirumular, மறுப்பது சாவையும். So we can postpone the death itself by using the kayakalpa. So the speciality of kayakalpa is described in this prose, that is karpam kayakalpam. If we take kayakalpam, our body kayam won't destroy. Our body won't destroy. That is கற்பத்தை உண்டால் காயம் அழியாது, கற்பத்தினாலே காணலாம் கைலையை. So if we take the Kai Kalpam, we can go Kailash with the body, and with the awareness, with the with our consciousness, we can feel and we can perceive the Kailash. And karpatinale kanalam jodiyai, that is the eternal perfection we can attain through the kayakalpa practice. Kayakalpa is not only a rejuvenative medicine conception practice, it is a rejuvenation and which gives immortality to the body and to the soul also. So it is beyond our imagination that the every human can every human, we can make one human, every human beyond their aim. So கற்பத்தினாலே காணலாம் ஜோதியை, கற்பத்தினாலே காலையும் கட்டிடே. So one who is capable to measure their breathing. This kale means breathing. So through the pranayama, we can go for immortal state. Like that they are describing. We are having one kayakalpa OP in our special OP in our OPD, and we are recommending some amount of some kayakalpa drugs in the OPD for everyone to wish to restore their health in a good condition, like that. And kayakalpa is various types are available, that is general and special kalpam, and it is based on plant material, mineral material, animal products are also used as karpam. And it should be taken every day, and for a mandala or some prescribed duration, or in our daily lifestyle practices. Like that, pranayama may be used as a kayakalpa, and meditation also is used as kayakalpa. So ashtanga yogam is described in our literature. This is ashtanga yamam niyamam asanam, like that. It is also described in ayurveda also, you all aware. And dhyana samadhi up to samadhi, this is the main aim of our life span. So some of our unique therapies are described. Sir, is it audible, sir?
Madam, audible.
Yes, sir. We have 32 types of varmam, 32 types of external therapies, and one among the therapy is varmam. It is a non-pharmacological, non-invasive therapy. We have some paduvarmam and toduvarmam, which paduvarmam is a very dangerous one. These points which are all hit by some force, this will hurt the entire neurological system of one person. So toduvarmam is 96. It is very superficial, and we can manipulate these 96 toduvarmam. Through this 96 points, some sub points are also available. We can manipulate these varmam points to make this energy flow through the subtle unique that which is called as saram, subtle energy force is without any hindrance it can be go anywhere in the body. So like that the varmam practice is varmam manipulation is done. Through the varmam practice we are making some therapeutic outcome for neurological, ortho, some neuromuscular disorders. um, Here we are having one special Varma OPD. So these Varma techniques are very well taught by some ancient, some old traditional practitioners in southern parts of Tamil Nadu. Our PG scholars are very much getting expertise through them, and by our faculties also expertise through them, and they are doing very specific varmam points to various ailments. So varmam manipulation can be done 1/4, 1/2, like that duration. So 2 matre, up to 2 matre, means which contains micro seconds. So the pressure and the time duration is measured by the asan and the varma experts. Like that we have to do, and it is a very unique method taught, yeah, prescribed in Tamil literature and varma literatures. So we are doing a lot in our Varma OPD, and this is a very fast growing system in our Siddha system. So so much of clinical conditions are treated by Varmam methods, and so much of best outcomes are received from various ailments, and surprising outcomes are also visualized by our faculties and the PGs. They are very much capable to diagnose and to treat the various pain conditions through Varmam. So these are all some kind of disorders which we can treat by Varmam itself. And along with Varmam, this is a physical manipulation. Some Varma, specialized Varma medicines can be administered parallelly for some conditions, according to their chronicity, according to their severity, according to their the condition of that patient. Like that we are administering some medicines also along with Varma. So this is a very fast growing branch of our system. These are all some Varma points we can manipulate, and we can get outcomes through these procedures. So pain management, how it is managed through Varmam is described scientifically. How Varma is placed here, they described in this slide. And later we can have a very yeah, established or extended version of this Varma, because I unfortunately I didn't learn Varma because I am from pharmacology department. I don't know much about the Varma and its method of actions. So, some like Varma, some massage techniques are mentioned in our ancient Siddha literatures, which is called as Tokkanam. This is a physical manipulation therapy. This is not at all simple massage, and along with massage, we are some pressure points are also manipulated here by tapping, punching, compressing, gripping, with oil or without oil. Sometimes some medicines may can also be applied on the area of the pain, and mainly the neurological and muscular diseases can be treated along with some medicines through Tokanam. Tokanam is it's a pattern of pattern like massage with some oils and with some ointments or some medicines. So it improves the body tissues, muscle cells, and muscle contraction and relaxation will be promoted, and the skin texture is also promoted, and it rejuvenates the nerves and muscles, and it improves the blood circulation, and it enhances the lymphatic flow also. So, like Varmam and Tokanam, one is our like Ayurveda, that is Karanul. We are calling it as Karanul, which is Sarasutra. Siddha, in Siddha also Trimular and Yogi Muni, Yogi Rishi are in their texts, they are describing the Shara Sutra and its ingredients to make a thread, and how to prepare the patient, how to introduce the thread into the anal canal, and how to treat the patients. Everything is described in our ancient Tirumular and Yogi Rishi. So some like your Shara Sutra, we are making threads through the Akiranthus salt. Nayurvi, we are calling it as Nayurvi Uppu, and some calotropis latex in a surgical thread, and it can be made by our faculties, and it is used in the yeah, anorectal fistula or in piles like that. We are treating more than up to more than 4,000 cases for the past 5 years. So it is, the recurrence is very much reduced yeah, through our treatment. So the patients are likely to, willing to take this treatment by pay option also they are opting. So this is a successful OPD unit. It is done through the OPD and IPD also. We are doing it very successfully. And another one is leech therapy. Leech therapy is used for some edematous condition, varicosity, varicose veins, and traumatic ulcers, chronic ulcers, and non-healing, and neurological ulcers like that, tropical ulcers like that. And it is a successful treatment we are doing here. We are having one air conditioned 24 hours air conditioned room for leech preservation, and we have more than 100 leech in that air conditioned room. We are yeah, using aseptic procedure to use the to clean the leech, and prepare the leech for treatment and therapy. So we are doing it in a yeah, aseptic manner, so that people opting this treatment also in a very very welcoming manner. So we are doing it in a scientific way also, not in a crude way. So this is yeah, the Agni Pariksha, like Chuttigai therapy, cautery method. We are using some amount of some herbal cautery, like it is turmeric, and it is metal. Here it is metal, and we use some metals or herbal twigs to heat the heat techniques in the particular points, so to treat some amount of neurological pains, or in fasciitis, plantar fasciitis like that, frozen shoulder like that, some spinal pain, and some warts and removal of warts, corn foot, molluscum like that. So this is like a cautery, electric heat application. And Siddha is basically we teach lifestyle modification practices and yoga practices and Kayakalpa practices. Kayakalpa practice through herbo-mineral preparations and medicinal plant uh, herbal treatment through the medicinal plants. So our usually actually Siddha system is very rich in higher order medicine. So we are having so much of metallo herbo mineral higher order metallic and high toxic medicines, mercury, arsenic, and various types of arsenics are poisonous drugs are used in our system for dreadful diseases like cancer, AIDS, and chronic lifestyle diseases, chronic endocrine diseases, like that. So we are a huge area is still not it is unexplored. And our higher order medicines, we have a rich resources through the higher order medicines, but some complications or some controversy is also met by our people, because people from scientific world, they claim some amount of metallic preparations are heavily toxic, highly toxic to the liver and kidney, so that they are against the higher order medicine. But the fact is, in our Siddha literature, the higher order medicines are having such a systematic system, very very particular systematic preparation and purification, and the dose regime is also clearly mentioned in our text. So the higher order medicines dosage is very very minimal and very very limited duration it is prescribed. For example, yeah, Tanga Pashpam, the Sorna Bashma in Ayurveda, for Tanga Pashpam, we are have the textual reference is only 30 to 60 milligram for only 1 week. After that, with some patyam, after that we have to go for a break up to 30 days or 15 days, like that. So this break period helps the body to eliminate that kind of drug which we are taking before that week. So it will completely eliminated through the through some various sweat, fecus, and urine, like that. So we have to give some space, break, and again we have to start for 1 week, like that. So it is restricted the dose. They restricted the dose, the duration of duration for which the medicine can be taken, and particularly the patyam and the break period. They are also suggesting some amount of practice or lifestyle modification, that oil bath or purgation or patyam, uppillada kanji, like that. So these practices supports the higher order medicine to assimilable, easily assimilable, as well as to eliminate from the liver, kidney itself, so that yeah, scientifically it is a traditional scientific methodology. We have to support these practices in future scientific world. We have to explore the possibility to reuse all the higher order medicines in practice. um, so we are having a huge area in higher order medicine. We will have some other occasion to describe all the in extensive manner. In a this is our new OPD block, which is built in an 3,000 square meter area, which is ground floor plus two first floor and second floor, which contains in the ground floor 32 rooms, consultation rooms, and one dispensary, long dispensary, which is having 12 counters. And in the first floor, the 32 external therapy rooms we are having, and only one long 100 capacity yoga hall, and one 500 capacity multipurpose hall we are having in our new OPD. And our NIS is an autonomous institute established in 2005 by the then Prime Minister Honorable Manmohan Singh ji. And after that, we are having so much of patient input, and our vision to develop a quality Siddha education and quality patient care through our system, and to propagate and spread our system to the globe, up to the global level. This is our vision and mission. And we are now we are having 8 branches in our PG academics, and PhD is also we are having in 6 branches. And this year we are going to start our UG program also. In our PGs we are having 58 students per year, and we have 3 years a course for PG, and 5.5 years for UG. These are all you people may aware about it. And we have supporting departments like anatomy, physiology, biochemistry, microbiology, pathology, modern medicine, and medicinal botany, pharmacology, everything we are having. And we are having some journal clubs, Siddha journal, Journal of Siddha, and we have regular journal club activities, and we promote our motivate our faculties and PG scholars to publish in a very high standard journals. And this is our staff strength, and academic laboratories are also available, and we have one animal house facility with CPCSE approved animal house. We are having rodents in our animal house, and doing some preclinical assay in our animal house. And these are all our lab setup, laboratory setup. This is first one is the biochemistry, pathology, and biochemistry, and our pharmacology lab. This is our motorized culvum, modern modified versions of traditional culvum, and this is our herbal house, and it is our animal house. These are all our faculties. This is our museum, and we are in a process of developing one raw drug repository, and it is our teaching block, library, and we have Journal of Siddha, like that. Clinical activities, we are having 11 special OPD set up in our OPD. So we run for 365 days clinical facility in our OPD. There is no holiday for our hospital. And this is our year-wise patient strength. We receive in the highest of 2018 to 19, it is nearly 8 lakh patients. Due to COVID, for the past 2 years, we have less patients. After that, we are receiving average 2000 to 2500 patients. This is IPD. We have 220 beds in our IPD with a pediatric ward and a special ward also available. These are all our special OPD. These are all our external therapies, Dara and Pravalayam, Patru, leech application, cautery, heat application, and fumigations, and steam bath. And this is fracture manipulation. This is Varmam treatment and yoga practices, Sharashudra, like that, clinical lab facilities, research activities. Parallelly, we are doing research activities as per the CTRI guidelines. DHR registered IEC also. Our IEC is registered with DHR, and we have institutional ethical committee, scientific advisory committee, and we are doing preclinical and clinical research in a well established manner. So much of infrastructure facilities are also available. We are doing so much of research projects. These are all some research projects, ongoing research projects by our faculties. And this is our newly established raw drug repository with the support of NMBB funded project, 5 crore funded project. NIS is the lead institute. We are collecting more than 3,000 medicinal plants and their parts, sample collection, as well as the herbarium and digital data are also available here. Soon this will be available to the entire country. And we have so much of MOUs with various prestigious institutions like NITM Belagavi. Soon we will have some MOU between KLE also. We are very much eager to start clinical research. Dr. Subarna Rai informed us. Soon we will come there, sir, and we will start a trial. So some initiatives through our MOU, we are doing a little. Publications are also motivated among our. We have some society outreach activities. We have medical camps, peripheral outreach camps, and during COVID, we are distributing so much of. Kabasara Kudineer in various places in and around Tamil Nadu and up to some New Delhi. Swachh Bharat activities, medicinal plant saplings, breast cancer awareness camps, screening camps like that. So we had done a lot during the COVID, and we have conducted 4 COVID care centers, and our faculties and PGs, they have round the clock, they in a roster basis, they have worked in the COVID care units in 4 units. So without any break, we did our best in during COVID, and these are all the number of patients treated during the COVID care centers. Uh, we have done some clinical studies in during COVID, and we have published this trials in reputed journals. So these are all the activities run by Balaji கொடுங்க. So that's all from our side, sir. This is about Siddha. Yeah, there is a lot to share with you, but within the short limit, I can elaborate a little.
Thank you, madam. Thank you very much. I think you have given a very elaborative description of the Siddha system of medicine, focusing on the basic concepts and the practice of Siddha, and also the achievements of your institution, which is really appreciable. And we definitely will be very happy to be associated with you for the integrative approach that we can adopt in various preclinical and clinical studies. I think now if we can take few questions from any of the participants or delegates. If there are any questions by the participants, you are most welcome to interact with the director, Dr. Meena Kumari, and later on we'll be very happy to know your feedbacks. So any of the delegates would like to ask any questions?
They can mail us, sir. I can share our mail ID, and we will clarify their doubts through
Sure,
our
sure.
mail, sir. Anyone want to know about Siddha, kindly motivate your CRRI Ayurveda students to visit our institute. Let them know about Siddha, and let them we can exchange our people to your institute also. So we can exchange our students. They can have some idea about Siddha, and what is common between us, which is unique in their system and in our system. They can know about through the visit. Sir,
Sure,
kindly visit. You also, sir, kindly come to our
sure,
institute.
sure.
Already I
Sure,
have
madam.
invited you. Yes, sir.
You also, madam. Please, next time when you come to NITM, please visit
Sure,
us.
sir. Sure,
Yeah.
sure.
Yeah. Any questions by any delegates?
Good evening, ma'am.
Yes.
It was a very informative session. Thank you for the session. My question is whether there are any ongoing research activities in Siddha presently. We would like to know about it.
Yeah, there are so much of ongoing processes. We are having one project in anemia in rural areas, and we are doing some adolescent PCOS project in our area, and some cardiac diseases also yet to start. Soon we will start CAD clinical trial, and some preclinical assays are going on in our animal house in our institute itself, and we have some research parallelly in some institutes like veterinary university in Chennai and IIT in Chennai, and some of Savida medical college, and another, and Wales University, like that. Some pharmacological research is going on. In our council, we are doing some our student projects in our council, Siddha Research Council near Chennai. So it is ongoing. Some research are also parallelly. It always go on progress, in progress. Some will be completed. Some is on progress. Some yet to start. So three categories we have.
Thank you, ma'am.
Yes, thank you so much.
Good evening, ma'am.
Yes.
It was a nice session, informative session. Thank you for that. Ma'am, my question was whether any tie-ups with Siddha are linked up with integrative medicines, and are any such researches going on along with integrated medicine system?
Please repeat the question.
Ma'am, are any other studies with integrated medicinal approach, the other
Yeah.
medicinal systems going on? We would like to know about that, ma'am.
Yes, we are planning to start one integrative cancer oncology OPD in our OPD, and along with the OPD, we are planning to integrate Siddha medicine along with allopathy. And we are having one model through Dr. Matthew from Kottayam. He is adding our Siddha medicine to very. He is actually basically a oncology radiology allopathy doctor. He is treating more than 10,000 cancer patients with the help of Siddha as well as allopathy. So that pattern we have adapted with his consent. We are soon going to start on integrative oncology unit in our OPD with the specific medicines, higher order medicines of Siddha. That will be a very, very unique pattern, and we are going to document, and we are making it to in a research aspect. We are planning like that. Two oncologists are yet to appoint. They have given their consent to join with them, and they are agreed to work with us, and without any financial benefit, they are willing to do that OPD in our OPD, and they are ready to contribute to the patients. So soon we will start this month itself. February 6th is the oncology day, I think, cancer day, I think. So on 5th or 6th we will start that program. You
Thank you.
please visit, madam, once you come to our institute. You can also have some idea, and you can make awareness about our proceedings.
Okay, ma'am.
Yes.
Thank you,
Yeah,
ma'am.
please
Thank you,
visit.
madam. Thank you
Thank
very
you.
much. I think
Thank
if we can just share your email ID also, madam, to with
Sure,
to
sir.
the
Sure, sir.
delegates.
Yeah, sir.
We'll be very happy. And now may I request Dr. Kadambari, the coordinator of guest lecture, to propose the vote of thanks.
Good evening, one and all. Good evening, one and all. I would like to express my gratitude to our today's special guest, Dr. Meena Kumari, Director, National Institute of Siddha, Chennai, for giving such an inspirational knowledge about Siddha system and Siddha medicine on the occasion of National Siddha Day. Thank you very much, ma'am, on behalf of KLE Ayurved.
Thank you so much. Thank you. And once again, I want to convey my greetings to you to celebrate the Siddha Day in your institute, esteemed institute. And thank you so much. It's our pleasure and fortunate. We are very fortunate to have you for the celebration of Siddha in your institute. Soon we will have a nice interrogation, integration with your institute, sir. Sure.
Sure.
Thank you, sir.
Ma'am.
Thank you.
I also thank Principal Dr. Suhas Kumar Shetty sir for his guidance and support. I also thank Dr. Ashok Patil sir, HOD and Professor Department of Swastruta for organizing such a good guest lecture. Lastly, I would like to thank all the delegates for their presence and also thank our technical staff for their support and arrangement. Thank you one and all. Thank you, ma'am.
Thank you so much.
Thank you. Thank you, ma'am.
Thank you, sir. Thank you. நிறைய பேர் ஜாயின் பண்ணியிருக்காங்க என்னப்பா